The Aga Khan University Hospital has set the standard for comprehensive healthcare and modern medical education in East Africa. The hospital has been committed to integrating health and education to address complex health challenges and enhance healthcare delivery in the communities it serves. And now, the hospital has launched its 53rd Outreach Medical Center at Imaara Daima Mall.
Well, let's meet the CEO, Mr. Rashid Kalani, to really help us understand, first of all, why this particular location for an outreach center and what is the future goal as far as access to healthcare, but at the same time offering quality healthcare to the patients is concerned. And the CEO is here. It's good to see you again. I'm tempted to say Happy New Year. First of all, congratulations.
Thank you.
Such a big day today, right here. Yes. So just tell us a little bit about, first of all, what is happening here today.
Okay, so this is our 53rd medical center. Across Kenya, we are in very many counties and cities. So in Central, in Rift Valley, in Mount Kenya region, we have gone as far as north to Wajir. So now this is our 53rd center. The demand for our service keeps on increasing, and what we see now, patients are demanding that we should bring the services closer to their homes. So this is our effort to bring patients closer to their homes. Now, so good quality services, and in this medical center, we will be starting with the doctor consult. Slightly different because we have a full-time family medicine consultant here who will be manning this clinic. So that's one part. Then there is lab, there is pharmacy. And then what we are seeing, and the patients are demanding, that we should bring in more and more specialists in these clinics. So we are bringing more and more pediatricians into the clinics. We are bringing obstetricians into the clinic. We are bringing gynecologists into the clinic. We are bringing internal medicine into the clinics. We are now seeing demand for surgical services in these clinics as well. So this is our agenda to provide access to the populations.
I see that. And the last time we spoke, we were talking about values and the values that the Aga Khan University Hospital lives by, Accra. And one of the things that you said is quality, which is important, but access at the same time. So I'm just curious, because there's a very big, space, not only here. So why this particular mall?
If you look at the commercial areas of Nairobi, if you go back 10, 15, 20 years, it was confined to CBD. For any businesses or for any commercial offices, it used to be CBD. But now, thanks to our fantastic infrastructure, which is growing, now people are moving out. You don't have to be in CBD to do business. So you see areas like Upper Hill, in Westlands, and so Kiambu, and so many other areas which are now growing. So this area is also growing, where the population is growing. So we cannot confine ourselves into Parklands, we cannot confine ourselves into CBD. So now, as I said, now we are expanding our geographical reach because the populations are growing and we want convenience for the patients. If you have to come to a hospital for healthcare, for even any outpatient facility, and if you have to spend an hour on the road, I think that's a day loss, right? So now we are going into the neighborhoods where there is population, where there is demand for the service, and where there is a need for the service.
Absolutely. And one of the things that I know most people will be concerned about is quality. Yes, it's good to have outreach, facilities bringing healthcare closer to the people. Sure. But some people will be like, will I get the same quality of service?
The principals, be it main campus, be it outreach center at Imaara Daima, be it a center in Mountain Valley or Valley Arcade or whichever clinic, the quality remains the same. The principles remains the same. IQRA, impact, quality, relevance, and access. When we talk about the quality, we were the first hospital to get Joint Commission International accreditation from US. And after that, since 2013, we are now going into more and more clinical program certifications. For heart attacks, for acute stroke program, God willing, we will be going for the breast cancer program as becoming a center of excellence first in Africa. So that quality is everywhere. The main campus, there is a quality department, which is an independent department. They ensure that the quality of care that is provided in the medical centers or in the main hospital is consistent. Now that begins with, when we talk about quality, quality has different phases. Quality of space, the space, the way it is constructed, built, the quality, most important part, the quality of people that we employ, the clinicians, the lab, the pharmacists, the consultants, that's another quality. Third is, what is the technology that you use, the quality of equipment that you use. As you know, when we talk about the diagnostics, the poor diagnostic will lead to poor interventions. So you have to ensure that the diagnostics are accurate. So the quality comes in different phases and in different phases. So now we are trying to ensure, like always, to ensure that there is quality and there is consistency in facilities, in people, in technology, in the way we provide the services. So we are more standardized in our approach.
Let's talk about the costs of care, and how does that then, translate, or how does that compare to the main facility versus here, and that is, where we are today as Imaara Mall.
When we talk about Aga Khan University Hospital, we are always faced with the dilemma that should we cut corners? Can we buy a cheaper machine? Can we hire a cheaper doctor or a staff and then compromise on the principle of quality? But we have consciously refused to do that. We want to provide good quality of services. So we hire the best people, we hire the right we buy the right technology, and we build the right facilities. So that's one part. When we talk about the cost or the cost of service at the outreach centers, it's a deliberate effort of the institution to keep the cost of care lower in these outreach centers.
One of the things that Aga Khan has also done is introduction of home care, right? Do you want to tell us a little bit about what that is?
It's a continuation of our principle of access, and also it's the humane thing to do. And I'll give you two different scenarios. If a service can be provided at home, let's say wound care service for surgical procedure, or a vaccination for a child, or a phlebotomy service for lab, you really don't have to come out of your home and you can get those services there. So that is providing access. It's from the comfort of your home. You can avoid the traffic. So that's one part. That's one example. Another example, which is more human example, we see a lot of patients who are end of life, who are or should be on palliative care, end of life. Now, nobody likes their loved ones to go away and die. It's human nature. But we know that we all have to go one day. So if someone is on a palliative care, end of life, they really should not be in the hospital. Sure. Why should family? It's an emotional burden and it's a financial burden. So if someone is on a palliative care, end of life, they can be at the comfort of their homes, spend time with their loved ones, with their grandkids, and what kind of care that is needed, it can be provided from home. So it will avoid those emotional pressures, those financial pressures. So there are two aspects to it. First is the convenience of the patient, and the second part is the humane factor, that people who cannot be or should not be in the hospital can be treated or can be looked after at home. So there are many services that we provide as part of the home services. So there is 12-hour, 24-hour nursing care, there is wound care, there is physiotherapy, there is home delivery of pharmacy. Our phlebotomists can come home and collect the samples for lab testing. We have recently started in Nairobi. It's only been 2 months, but we already see a demand from outside of Nairobi to expand these services. But expanding these services, going back to your first question, will we be able to provide the right people? Will we be able to provide the right quality? Unless we are assured of that, we will not venture out.
All right, so I can see the center clearly marks Aga Khan University Hospital. And this is the Imaara Daima Center. All right, so and talking about home care, someone watching us today might be thinking, okay, so if I'm not a patient, that is Aga Khan University Hospital patient, does it mean that I don't get access to home care, or what happens?
It's an important question. So patients who are Aga Khan University Hospital patients, they can access home care. So let's take an example. So let's say if you had a surgical procedure at the hospital, and after the procedure, when you are discharged home, you require wound care, or you require nursing care, or you require physiotherapy, the nurse will onboard you, and then the care will continue, because we have your patient medical records and we have your charts. If the procedure was done at any other facility, at any other provider, and when you go home, you still require that physiotherapy, wound care, or nursing care, then you can call our call center, our nurse navigator will get in touch with you. They will look, they will request, and with your permission, they will look at the charts that you have to understand what the needs are and what level of care that you need, and then the home care can begin. So it is open for anyone and everyone, be it Aga Khan patients or any other patient.
All right. I like the aspect of convenience. One might also be wondering about the cost as far as home care is concerned. What does that look like?
The home care, it will be cheaper than the medical center as well as compared to the main hospital. But obviously, as you can understand, that there is a cost to provide care. If the nurses or the phlebotomists or the physiotherapists, and they have to travel, there are additional costs to it. But what we have tried to do deliberately is to lower the cost and cross-subsidize.
All right. And the last time, I'm referring to my notes because I wrote this down from our conversation the last time we spoke. And that is the bigger goal. And this is according to you, one of the goals was to make Kenya the hub of medical tourism in Africa. You also said the goal is to expand education as far as education programs, and that is on fellowships. Another thing was to continue investing and sustaining quality healthcare agenda, which I think that is already happening. And another thing is to invest in research. And you said, as Africa, we're more users as compared to creators. I remember very well, all right? So this goal, does it still stand? Have you expanded on the goal? And what does that look like?
It stands, it will continue to stand, and my hope, my wish, my prayer is that we can make Kenya the hub of medical tourism. Let's take different aspects to it. First aspect is, as I mentioned earlier, quality comes with people. You have the right quality of people. In 2003, 2004, His Highness the Aga Khan converted this hospital, Aga Khan Hospital, into a university hospital. So we are not only required to treat patients, but we are also required to train doctors and nurses for tomorrow, because that will provide sustainability. We need more specialists in many different fields. So Aga Khan University Hospital, university being an important part of the sustainability, so we have the right people for the job. So that's one part. The second part, that like you mentioned, that quality. If someone is outside of Kenya and they are searching, they are looking for a healthcare provider which is of high quality, when they look for Aga Khan University Hospital, and I hope other Kenyan institutions can follow suit, they see that internationally recognized, internationally benchmarked institutions. Joint Commission is one of them that we have gotten an accreditation. CAP, the College for American Pathologists, for our laboratory services. So that's one part, because that what you are doing, you're giving confidence to the patients that if you come to Aga Khan University Hospital in Nairobi, Kenya, you will get the same quality of care as you would get in other parts of the world, be it in Europe, be it in North America. So that is the second part. And the third part, like you said, and I am very passionate about it, that if you look at the LMIC and developing countries, we have always been the consumers of knowledge. Our hope, our vision is, and this is what we are working towards, is that we do more cutting edge research, so then we become contributor to the world knowledge of medical, right? Absolutely, we have a clinical trials unit led by an oncologist who is a full professor from US. There are other local fellows who are working under them. As I mentioned, that we are a teaching hospital, so we have very many fellowship programs in medical oncology, in hematology, in nuclear medicine, in infectious disease, in neurology, pulmonology, etc. So the list goes on. What we are trying to do is to lock them in by providing good quality of education, providing them the good tools so that they can practice good medicine, the technology part. And the third part is that they can do research as well. And then investing in quality of facilities, quality in process, quality in people, so that we can give confidence to the patients who are coming to us, be it Kenyan patients or from outside. So I'm very excited about it. I'm very aggressive about it. I'm very hopeful about it. But obviously, we as a country will have to invest a lot in infrastructure, especially on the manufacturing side. Your earlier question about the cost, I think anything that land in Kenya, then there is import duty, there are VAT, there are taxes, there are importers, there are distributors. If we can get manufacturing base going, I think that would be a huge win and a huge contributor to our vision of making Kenya the hub of medical tourism.
So as we bring this to a close, and you're a numbers guy, Like we all know. So Aga Khan treats over 700,000 patients every year. And again, from our last conversation, you said Aga Khan University Hospital spends over 800 million shillings every year to train, the medical, all those things. Yes. Oh, it has gone up. Yeah, you said that keeps increasing in double digits. Yes. So then what does the future of care look like from your eyes, from where we are at now as a country, and looking forward? Because like you said, healthcare is not just about now, but it's also about tomorrow. So what does that look like, and what is Aga Khan doing to make sure that we achieve that from curative, what we're doing now, to more prevention?
As I said, that we will continue to invest in education. In 2023, and that data is available, it's not a hallucination or a reading. The hospital contributed 1.3 billion shillings to the academic programs, Medical College, School of Nursing, and other research initiatives and programs. So the cost is there on the university side, on the people side, on the technology side. But then your question is valid, that how do we control the cost, or how do we have efficient operations? That is why we are opening up these medical centers, and we will continue to open these medical centers. And as I mentioned, these medical centers cost is 20, 30, 40% lower in many of these centers. So this is how we lower the cost and provide access. And as I mentioned, that not only these medical centers are not only in the neighborhood, but what we are now trying to do is to bring specialists to these medical centers. So you don't have to, if you want to see a pediatrician, then you don't have to come to a main hospital. You can see a pediatrician in this medical center. If you want to see a medical oncologist, very soon we will be bringing medical oncologists, the cancer doctor, to these medical centers as well. So what we are trying to do is to push many of the primary, secondary services outside of the main hospital. So it's a convenient aspect as well as the cost aspect.
So this is the 53rd medical center. What is the goal? What is that number where you look and be like, what, we have achieved it?
We don't have a goal as far as number is concerned, but our goal will be driven by the patient's demand. When the patient's demand, for a particular service in a particular geography, we go and assess the market. We do a competitive landscape. We look at the disease burden, and then that's how we start a medical center. So I don't have a number, but we should not forget that this Aga Khan University Hospital in Nairobi, we have 53 outreach centers. But there are sister institutions. Aga Khan Hospital Mombasa looks after the coast. Aga Khan Hospital Kisumu look after the western area, western region. These two hospitals also have medical centers. Between them, these two hospitals, they also have now 30 plus medical centers. So if you combine our strength of the three hospitals, Nairobi, Mombasa, and Kisumu, besides these three hospitals, we have very close to 100 medical centers in different geographies and serving the communities and the population in different areas.
Absolutely. And Aga Khan is really trailblazing from being the only private hospital that has teaching, right? Hospital to, again, setting up.
It's a proud moment for me and my colleagues, absolutely.
Yes, and I must say congratulations for this launch today. But I'm curious to get to understand, okay, so what exactly does the facility look like from the inside? But you're a very busy man, so I'm going to let you go. Sure. But of course, when we come back from the break, we'll have a walkthrough inside so that you get to see what are some of the services that you will be getting from this particular facility, and that is the Aga Khan University Hospital, Imaara Medical Center. All right, so see you after the short break. Welcome back to the show, and today on Your World we are on location and we are at Imaara Daima Mall, but the Aga Khan University Hospital has opened a new outreach facility, and it is the Imaara Medical Center, and that is where we are today. And before we went on a break, I told you I'm really curious to understand what are some of the services that are being offered here. So come with me, Dr. Emma. She is a family physician. She will take me through this facility and just to see what some of the services that you will get from here. She's very busy, so I'm going to steal you for a sec. And thank you so much for sparing your time to really help us to understand, what goes on here. But just in case someone is tuning in, first of all, before we continue, right? Do you want to say hi, Wambie, who you are and what you do?
No problem. Hi, everyone. My name is Dr. Emma Habure. I'm a family medicine consultant, just recently graduated from the Aga Khan University. So let's just say I'm starting off my career.
I know majority of the people will be like, how different is it? See, we just go to a hospital, see a doctor, and then that's it. Why family doctor?
So a family doctor has to undergo intensive training. We actually go back to university and do a Masters of Medicine in Family Medicine, whereby you interact with other specialties, the pediatricians, obstetric department, the ENTs, just a vast variety of specialties. And from that, you're able to provide better specialized care to patients, depending on wherever you've rotated in. And as a result of that training process, you're actually at a good level of managing patients as a family doctor.
So what you're saying is, if I come to you, right? So it's the same way I will see a pediatrician, I will see all these other specialists all in one.
Yes, you're very correct to say that.
Okay.
Yes. Right. However, we also have our limits. And that is where we now provide collaborative care and we coordinate care with the other specialties. So I could, for instance, see a baby and I'm not really sure what's going on despite my level of training. Now that's when I rope in the pediatrician who can give further advice on how to proceed with the management.
Okay. I can see there's this side, there's this side, and there's this side. Okay. Where do you want us to start?
We can start with this side, if that's okay, and I'll take you through the clinic. So if you can start from here. Yes, sure. So this is our counseling room. It's not for counseling patients who are coming to see a psychological counselor. It's more or less where patients sit and get counseling on the medications that we've prescribed. And so the pharmacist takes them through on how to take it, side effects to look out for, and such things. And patients also get the chance to ask questions while preserving the privacy and confidentiality of their medical condition. And then over here we have the pharmacy. So this is where our pharmacist gets in and gets out. And we have a large variety of medications we have over here, ranging from all sorts of medical conditions. Remember, a family doctor sees a whole family. So I should be able to manage your URTIs, which are upper respiratory tract infections, your UTIs, your urinary tract infections. Maybe you have a pneumonia. Maybe you have diabetes, high blood pressure, cholesterol. Name them. I should be able to manage them. And so over here we have the medication available. Yes. Everybody needs. Yeah, sure. And right over here is where we do our ultrasounds. So we have a sonographer that comes in 3 days a week. This is now on Tuesday when we have a gynecologist available. And on Friday, we also have another gynecologist, and on Saturday as well. Hi. How are you? I brought for you some visitors. Yes. So this is Hyleen. She's a very able sonographer. Yes. And she can show us her very fancy machine.
Here, we have Mindred BC75 ultrasound machine. It's a good machine. We do most of the ultrasound scans, starting from full abdomen and pelvic scans. And we do musculoskeletal ultrasound. We do Doppler ultrasound and cardiac ultrasound.
So depending on the areas that she's mentioned, she'll be able to now take the probe, apply the gel. We actually warm the gel with the machine. And so she puts the gel on the probe with the patient lying over there, and then she'll be able to see the images that will be over here on the screen. And thereafter, she sends us back our patients, and we're able to tell them what Hyleen was able to see and have a way forward in terms of your management. So when Hyleen isn't there, we can convert it into a consultation. Yes. So now we have 2 other consultation rooms. One of them is being occupied by our OB-GYN, who is in today. So she comes on Tuesdays and Saturdays, morning hours. And maybe we can check and see whether there's someone. All right. Okay. Hi. We have some visitors for you. Yeah.
You have a beautiful office. It's like literally the corner office. You can see everything that happens, all around. But it was a good. Yeah, it's good to see you. Thank you so much for allowing us into your space. First of all, they have ambushed you. I am so sorry. But yes, but people want to know who you are, what you do, and what you do for the people here.
All right. My name is Dr. Debbie Mundia. I'm an obstetrician gynecologist here at Aga Khan University Hospital, the Imaara branch. So here at Imaara Hospital, the Obs-Gyn unit, we offer both obstetrics and gynecological services. Obstetrics involves the pregnant women. So we see pregnant women in the first, second, and third trimester. It's a one-stop shop. So we offer ultrasound services for the pregnant women. We also conduct the relevant lab services that they need while they are pregnant. We also offer pre-conceptional counseling. That's counseling before the women get pregnant. And we also offer postnatal services. Postnatal services is the reviews that they need after pregnancy. We offer family planning services. Under family planning, we do give the pills, we give injections, we give implants, and we also insert IUDs here in the clinic. We offer gynecological services. These are the benign gynae conditions that are there. This includes fibroids, things like polyps, things like ovarian cysts, things like adenomyosis. And we offer, again, the same ultrasound machine is able to pick up the gynae conditions in our women. The next thing that we do, we screen for the common cancers among women. We do cervical cancer screening. So we do that using the pap smears. We also do testing for HPV virus here in the clinic. We also screen for breast cancer, and this is the clinical breast examination. We also send these women for mammograms in the main hospital, however. We also screen for sexually transmitted infections here. Lastly, we do see women with fertility issues, so we do fertility evaluations. And we also see menopausal women, and we go through the issues that menopausal women go through.
Now that we have ambushed you, I'm going to sit, because I have so many questions for you. And one of the things that a lot of women would struggle with is, when do I need to start, going for gynecological, I don't want to say screening, checkups, all those things, right? When should women start that?
So they should start as early as 25 years of age. That's when we start screening our girls for cervical cancer, and what we use is pap smears. However, there is a new guideline that has been rolled out by the Ministry of Health where we are now doing screening for HPV virus, but that starts at 30 years of age. So ideally, any woman more than 25 years of age who is sexually active should have a gynae visit at least every year. For younger girls, we also see them. Any girl with any menstrual disorders, any painful menses, heavy menstrual bleeding, or any issues involving the genitalia, we can see them as early as possible.
Speaking of painful menses, okay. There's a lot of conversation around pain. And one of the things is, should it first of all be there? So is pain normal? Okay. And if it is normal, to what threshold? Because again, people respond to pain in different ways, right? Yeah. So can we just address this whole aspect about painful menses?
They could either be painless or painful. Having painful periods is normal. However, the intensity of the pain is what matters. So mild to moderate pain is acceptable, and that's normal. And by mild or moderate pain, I mean pain that is relieved by the oral painkillers. This is over-the-counter painkillers. However, pain that is severe enough to interfere with either school or work, that is abnormal pain, or pain that is so severe and it's also associated with other things such as nausea or vomiting, or painful defecation, that's pain when passing stool, or also pain that is associated with painful intercourse, is abnormal and should probably be checked out.
What could that be a sign of? And I know recently we were just talking about endometriosis. Like, what could pain be a symptom of?
So a severe menstrual pain could be a sign of endometriosis. It could also be a sign of fibroids. Endometrial polyps also present with painful menses, and also lastly there's a condition called adenomyosis, which could also present with severe period pain.
What should women do instead of just sitting at home and saying, you know what, pain is normal and this is what we go through on a day-to-day basis?
So what women should do, they should definitely be seen by a specialist, that's an obstetrician and gynecologist, to assess what kind of pain they have. So when they come, we usually do investigations, one involving a pelvic exam, just a general physical examination. We examine their abdomen, we do a pelvic examination. In most cases, we send them for a pelvic ultrasound just to rule out any condition that they might be having. Then at that point, we'll be able to classify their pain as either normal or abnormal pain.
And you said all the services are here.
So all the services are here. Antenatal services are here. Postnatal services are here. Family planning is offered here. Screening for cancer is offered here. The only thing we don't offer here are surgical services. and the maternity services now when it comes to delivery. However, we follow the women right from the moment they get pregnant to the moment they get to term. Then now once they go into labor, we refer them appropriately to the main hospital.
We thank you so much for your time. I did not finish my tour of the facility, and I'm not too sure where to go. Okay, all right. Okay, but congratulations, really, like I said, for launching this facility, because again, you're bringing care to the people when they really need it. So, what are some of this? And I know we've mentioned it during our conversation, but what are some of this gynecological, concerns that you see women, come to you about?
Okay, so the common conditions: one, abnormal uterine bleeding. So we classify abnormal uterine bleeding into three. One is the duration of flow. Two is how often the period comes, and three is how heavy the period is. Yeah. So women tend who come with periods lasting more than 8 days, we classify that as abnormal uterine bleeding. Number two, intermenstrual bleeding, where you find in between your periods, you're having intermenstrual bleeding. So bleeding, and also bleeding that is so short, the intermenstrual period lasting less than 24 days or prolonged more than 38 days, that's abnormal uterine bleeding. Then lastly, the flow, so very heavy bleeding. For example, women changing more than a pad every 3 hours, or bleeding in clots, or having to wake up frequently at night to change your pad, that is definitely abnormal uterine bleeding. The second common disorder that we manage here is abnormal vaginal discharge. So discharge is normal in a woman. However, it should either be white or clear, depending on the phase of your cycle. It could either be thin or thick. However, discharge that's either green in color, creamish in color, yellow in color, or discharge that has a foul smell is abnormal and definitely needs to be checked. So this could signify, in most cases, it's an infection. It could be a sexually transmitted infection or just a general infection, but it could also signify something more ominous like a cancerous process.
And we do not want to catch that when it's almost too late, right? Okay, I'm really happy that you've pointed that out, because again, like I said, majority of these things we think it's normal, but really isn't, and we really need to be cautious about. So, how often then? I know we asked when should women start, seeking your services, gynecological services. So the other question is how often?
So every woman should have a pap smear done every 3 years. However, this is individualized. It depends on whether your previous pap smear was normal first and foremost. And now we've rolled out a new screening service which is more sensitive. This is called the HPV DNA. And what the HPV DNA does, it screens for the HPV virus itself. So it's more sensitive than a pap smear. So the HPV DNA, we do it every 5 years. So you can opt to either do the pap smear every 3 years or do the HPV DNA every 5 years. We also advocate for women to be seen every year for at least a clinical breast examination at the very least, after which we refer them to do a mammogram for women who are more than 40 years of age, or a breast ultrasound for women who are less than 40 years of age.
Yes, that's very informative. Okay, all right. I can see her. Dr. Emma, but really, Dr. Debbie, thank you so much. We've learned a lot, and, aside from just coming to your office and getting to see what you do, but we've also learned, quite a lot. So it's important for women to have this information. And if they are around here, they are most welcome. Please come to Imaara Clinic. We have all the services that you need. All right. Thank you so much, Dr. David. All right, Dr. Emma. So we're done with this side. Okay. Pretty much.
Yeah.
All right. So where do you want us to go next?
Right. Our main waiting area. So most of the patients who are seated here are those who have just finished with the billing process at the reception and are waiting to be called to triage. But are also from triage waiting for me or the other doctor to call them, or are also waiting to be seen by the sonographer for their scans to be done. Thereafter, once we are done with the patients, we actually send them to the pharmacy.
Okay.
And they usually sit at that waiting space over there. And then once they're done, we wish them a quick recovery and they can go home.
Visitors leave at their own. Yeah. Okay. But this is really nice and calm and very well organized, which is nice to see. Okay, so I'm going to hand you over the mic for the rest of the tour. Listen and nod.
You're most welcome. Yeah. All right. So over here, we have quite a number of rooms over here. So I'll start on my right. We have the server room. So this is where our CCTVs are, our internet cables. It's basically another whole IT department. Yes. So usually when we have challenges in terms of the internet and all those other, issues, they usually come and check with this place first to see what they can rectify and help us have a smooth, process of activities during the day. To my left, we have the triage. I can see that it's occupied. Yeah, so we usually have these tags. So one side is occupied, another side is vacant, so that it helps the person on the outside know whether it's safe or not to come in, observing patient confidentiality and privacy. So my nurse sits there, she does your blood pressure, checks your height, weight, all those things that we usually check to see, are you okay, before you actually see the doctor.
All right.
Yes.
Sleep in the bed.
No problem. So this is the last consultation room. So consultation room 4, we have 4 of them. And this is where I usually sit in. So for today, I have a doctor sitting in for me. We are all primary care providers. So in case of anything, they are close to the nurse and you're able to coordinate the patient's care without, moving across floors and someone feeling uncomfortable about it. Yes. All right. Occupied. All right. To my right, we have the medical store. So this is where we keep our emergency equipment and any other things that us as doctors require to do procedures. So most of the things here are sterilized or they're for emergency purposes. Yes. No. Yes, please. All right. So on my right again, we have the phlebotomy room. You can just have a look and see our phlebotomist, who is the person who draws your blood sample, sits on this other side and tries to make the process a little bit less painful. Tiny little prick so we get the most sample without you complaining about the pain.
Yeah.
Yes.
I was just looking at the video.
Yes, yes. And so this is her office, the laboratory. So when patients are sent for samples, be it urine, stool, we usually ask them to put their samples here together with their receipt. And if it's a blood sample, by the time you're coming here, you've passed by the reception and they've billed you. So all you need to come with the receipt. And you can press this button over here and she'll come to your aid and advise you accordingly.
Okay.
Yes.
All right.
Yeah, so over here, again, we also have this on the door. So there's a tag written emergency in progress, should there be any, and on this side, it's procedure in progress. So it really depends on what is going on. We can go in, actually, because our emergency has been cleared. Yeah. Yes. Yes, has been dealt with successfully.
Yeah.
Yes. Okay. Yes, yes. So patients come here and we advise them to lie down. Sometimes it's the person at the front who's able to assess and see this is an emergency that's coming. You could be coming, you look like you're about to fall down. So it's the receptionist or the pharmacist or the guard who will direct the patient to this emergency room. In the meantime, I could be seeing the patient. As you've seen, there's a doctor seeing a patient, there's a nurse seeing the patient. And once the patient is here, we actually pull the string over here in case of an emergency, and a bell goes off for all of us to hear, and we're able to tell that's an emergency. I need to stop what I'm doing and come and respond to the yes, exactly. So the nurse usually comes, checks the vital signs. I also come, ask my many questions, trying to figure out what is it that's going on with you and do some necessary tests. As you can see, we have some equipment there. Some are to draw blood samples. Some are to do interventions, maybe you're having a wound that's gushing blood and need to apply pressure. So we have all this within reach. Yes. So not only do we handle emergencies, but do we also do procedures? Some patients who've been seen at our main hospital, post-surgery, they have wounds that require, follow-up, and they find Imaara Clinic closer to them. So we actually encourage them to come. We have a check and see, do you need to see your doctor, or we can continue with your wound care. Some also come from other hospitals and they still come and see us, and we take care of their wounds right over here. And last but not least, this bed actually is our resuscitation bed. So in case we get a patient who's flatlined and we call a code blue, we, sort of like move the bed away from the wall. As a doctor, you're the team leader. Team leader, you assign roles, tell, I want you to do this, I want you to do this, I want you to do this. And we're able to coordinate that care for that patient, provide the CPR, which is now cardiopulmonary resuscitation. And you can actually disassemble the bed and transport your patient to the ambulance that's waiting downstairs. Yes, You don't take the whole thing. You just disassemble parts of it. Yes. Yes. We have a crash cart that has all that, and it's actually in that medical store. Yes. Yeah, exactly. There's that as well, and the medication. We also need to preserve it at a certain temperature. So our medical store is actually very cold, and so we want our medications preserved longer at a certain temperature. Yes.
And just a few questions really about you and what you do, because like we said when we started the tour, is most people would say, but why do I need a family physician or a family doctor? Because I can just go to any hospital, see a doctor, and then that's it. So can we really stress the importance of a family physician or family doctor?
All right. So for us as family physicians, we don't just see you as a patient. We see you in totality. Yes, you've come to see me because you're having a sore throat in this day and age of COVID. But I'm going to have to ask you, do you have other medical conditions that you're being treated for? Because they could be contributing or not. But I also want to know, for these other medical conditions, is there a doctor following you up for? If you tell me no, I'll be more than happy to follow you up with that medical condition, regardless of the complexities, because we have the advantage of having our specialists in the main hospital, and they're a call away. As you can see, there's a phone here. Every room has a phone. So I just need to know who's a doctor on call. And I make that call, and we're able to sort you out there and then, right? And other than you as an individual, you're going home back to your family. So I have to ask you, okay, you're having a sore throat. Is there anyone else at home who's having symptoms? If you tell me no, my role is to promote the preventive aspect of it. Yeah, I could diagnose you with a potentially communicable disease, and I would tell you, okay, so for example, hepatitis A, it's actually something you need to notify. So I need to know what school do you go to. I need to talk to the officials of that school. I need to advocate for your well-being. I need to advocate for the other students. They don't get, infected. So it's a matter of, I'm not just looking at your symptom today. I'm looking at you as an individual who comes from a family, who lives in a community, and you need me to be your support system while you're out there.
So for someone who's watching us and thinking, so then what is it that I need to look for when considering a family physician?
Okay. So we are, number one, we're very few in the country. We are so few. In Aga Khan itself, we're very few. But what you would want to look for is, do you feel comfortable with that doctor? Yes, they've told you they're a family physician. Do you feel that you can have proper communication between the two of you? Do you feel like they're caring towards you? Because the more you feel that you're developing a relationship with your doctor, the more you can tell them more, and the more it can help us manage you in the long run. So if you're able to find one within your nearest facility, I'm here at Imaara. You're more than welcome to come and look for me and tell me, Doc, I've had this problem. I need your help. I'll be able to tell you, oh, this one requires this specialist. Let me call them for you and refer you to see them. But I'm more than willing to continue your care once you're done with the specialist.
From a child, all the way to a grandpa, if I can say that, right?
Exactly. Yeah. That's ideally what we are doing. Yes. If you're, as family doctors, if you're able to come, I see you as a child growing up, you become an adolescent, you're a young adult, and I'm also able to tell that within your family you have these certain conditions, I'll be able to guide you and tell you, hey, look, XYZ was happening to your dad, it might also happen to you. How about we start screening for you early? And this is where now your wellness checks come in. And then we advise you accordingly. Yeah,
I really see that, because then some of these conditions you're able to pick up early, start interventions early enough, and of course that influences the outcome, which is usually on the positive. Okay, so you said you're very few right here in the country. So are people responding well? Are people, taking up more, taking up the responsibility to look for a family physician and, have them work with them, for the rest of their lives? What is that like here in the country for the few times you've been here?
So not many people know about us. Let's start with that. And for the few that do, they really appreciate our services and they keep coming back. Yeah. We have a lot of repeat clients. And for those that don't know, it's okay. It's not your fault. Yeah. We're also trying to, preach our gospel truth out there as family doctors. We have our own organization. It's called Kenya Association of Family Physicians. And we're really trying to put our name out there, not just to patients, to also insurance companies, to the government. We're trying to show them that, hey, we have a role to play and help you with your health agendas as going forward. Yeah.
Thank you so much, Dr. Emma. And like I said, you're very busy. We stole you for a few minutes. I said for a sec, but it turned out to very many minutes. But we really appreciate that, because then we get to see and understand what care looks like from kawaida doctors, go to a hospital, see a doctor, mkishamalizana, goodbye, see you later. But to also have a moment to understand what a family, physician or family doctor, does and why it is important for all of us. Okay. So do we finish the rest of the tour?
It's very big.
It really is so big. Okay. So, and we've gone through a number of rooms, but I know this is not it, right? There's so much that happens. But I want you to talk a little bit about health-seeking behavior as a people, all right? Because it's one thing to have a center or a medical facility near you, but it's also something else for people to come to the facility, when they seek care. Because most of us, if it doesn't hurt, we're not going to a hospital, right? So do you want to talk a little bit about that, and what is it that we need to do in order to change that attitude?
Okay, all right. So we don't have the greatest of health-seeking behaviors. Women tend to score higher than men, and there's even research that proves that, right? And I guess it's because as women, we probably talk to each other more, and you tell your lady friends, hey, I saw a doctor and I had the same problem, and so they recommended, how about you also go there and get checked and see whether it's the same thing that you're dealing with or something different. I know for men it's a bit different. In fact, there's this joke we have in the medical fraternity whereby if a man is coming to hospital, a man is sick. That man is very sick. Yes, yeah. So what we try and do is just try and promote those annual wellness checks so we can get you at the early stages of maybe an oncoming disease. And we can tell you, hey, we are going a downward spiral. We need to stop what we're doing and do things a bit differently. Yes. And that's why we have the annual wellness checks. And I'm sure insurance companies provide for that in their packages. And for those that are able to come, regardless of wellness or not, we still try and promote health-seeking behavior. And I'll tell you, fine, you're coughing and it's nothing serious, but if you see you're starting to develop a fever, you're having pain in the chest, you're having, you're vomiting, you're not vomiting before, please come back to hospital because something has changed. So don't just sit on it.
And I really hope that at some point we'll get to that level where we change our attitude, first of all, as far as the hospital is concerned, change our health-seeking behavior. And you mentioned screening, which I think it's very, very important. So do you want to talk a little bit about some of the screenings that you conduct here in this facility and how often they're done and how often we should, as a people, go for screening?
All right. So thank you for that. So for screening, we do offer the different packages for wellness, men, women, over 40, below 40. So it really depends on your age, first of all. And regardless of your age, you also look at, so what other things are going on at home? Remember, as family medicine, we're really concerned about your family setup. So let's say dad had an issue, grandpa had this issue. And I'll tell you, so yes, we offer this package as Aga Khan, but I would recommend the following tests, just so that we make sure we're in the clear. Right? We also have, I believe the gynecologist, Dr. Debbie, talked about some of those packages. And we say do them once a year, unless need be. Like if you have cholesterol issues, I will not ask you to do that test once a year. I'll ask you to come a bit more frequently than someone who doesn't seem to have cholesterol issues and seems to be doing their diet and exercise very well. I will see them less frequently than someone who's already having an ongoing medical condition. So annually, if possible. I know other things like mammogram, we say every 2 years because of the radiation exposure. Pap smear every 3 years unless you have other issues ongoing. But basically every year.
Yeah.
Yes.
At least go for some of those screenings, right? Okay. So I know there's that aspect of fear. What if I go to a hospital and I am told I have this and I am not ready to deal with that? Nobody is ready to deal with, bad news. But really, so there's that aspect of fear that most people would not come to a hospital and get screened or, check up, right? what would you say? How do we, I don't know how we'll deal with this and just really just, because at the end of the day, we really need the care. We need to know. And like we said earlier on, the earlier, the better. So how do we change?
So the beauty about family medicine is you're taught about communication from day one to day last. You know, you're taught how to talk to patients, because I'm not gonna come and tell you, Doc, I've been treated for this, please check for me this. No, because you're gonna tell me I still have the condition and I'll feel bad about myself. So we employ a lot of ways of talking to patients. Some of them we call them motivational interviewing skills or brief counseling sessions, where I can get from you and hear where you're coming from with your fear. For example, you could say, my mom died from kidney failure. Please do not check my kidneys. And I'll honestly understand you from a human point of view. And I also like to hear more about it. And I'll tell you, look, let's just do the test. If at all we find a problem, we can intervene early before now the failure starts setting in and it's a bit too late. So when you're able to talk to someone like that, you know, they will just be like, okay, fine, just check and see. And then when they see there's no problem, they'll even be more encouraged to come back. And the moment you start detecting a problem, they'd feel a bit encouraged and say, okay, for the past 5 years, things were good. But now things are going down, but I can trust my doctor to do something.
Yeah.
And that is why family medicine is the way to go, actually. Because we try and just hold your hand and take you through your journey as a patient. Yes.
Dr. Emma, I really want to stay here for the rest of the day, but I can see there are a number of patients who really need your services. I'm going to whisper and say thank you really for your time. Really, really appreciate it. And once again, congratulations for the launch of this facility right here, right, at Imaara. What do you want to say to the people who are watching you and maybe they're within the vicinity?
Yes, please come to Imaara. We have family physicians who are able to take care of you. We usually say, from the moment you're born to the moment you're a bit older, we take care of all of you. And if you need specialist care, we will call those specialists for you and determine a way forward for you. So don't be shy. Come do your wellness checks. We're happy to assist.
All right. What a way to end the show. I mean, listen, let's release Dr. Emma. Thank you so much. All the very best with your patients. I will make it... I'll challenge myself to also come and see you, right? With my entire family. Yes. Yeah. With my entire family. The whole family. Because that's the point. Thank you so much, Dr. Emma, really, for your time. I'm going to see myself out so that you attend to the patients. Okay? All right. And you too. And I'm pretty sure that you've learned a lot from today's show, where we not only just talked about healthcare, and, you know, the access to healthcare, but the fact that now you have a center near you where you can get all your needs catered as far as your health is concerned. So now there's no more excuses that, oh, I have to travel miles and miles and miles away to access healthcare, because really the Aga Khan University Hospital is doing the most. It's a trailblazer in bringing access to healthcare closer to you. All right. So we have to end it here today. My name is Winnie Lubembe. Enjoy the rest of your viewing. I'll see you next time right here on Your World. But until then, I'm going to see myself out. Goodbye.